Hello everyone and welcome back to my video.
In the maritime industry, medical care training and medical first aid training serve different purposes and levels of medical emergencies. Both are crucial for ensuring the safety and well-being of crew members as required by the STCW, Standards of Training, Certification, and Watchkeeping for Seafarers, Convention. Definition and purpose: medical first aid training focuses on providing immediate, short-term care to stabilize an injured or ill person until professional medical help is available. Its purpose is to prevent the condition from worsening, preserve life, and promote recovery. Medical care training, on the other hand, is advanced-level training for prolonged medical care, diagnosis, and treatment of serious injuries or illnesses. Its primary goal is to manage critical medical conditions on board, especially during long voyages when evacuation or professional medical assistance is delayed. Target audience: medical first aid training is intended for all officers and designated crew members. It equips them with basic skills to handle medical emergencies that may arise on board. This training is at an entry level and prepares seafarers for the initial response. Medical care training, however, is designed for masters, chief officers, and senior crew members who are responsible for medical care on the ship. It is a higher-level training program that enables them to provide prolonged care and advanced treatment. Training content and scope: medical first aid training covers basic-level care with a focus on stabilizing the patient and managing immediate threats to life. Key components include basic life support, BLS, performing CPR, cardiopulmonary resuscitation, and using an AED, automated external defibrillator. Initial assessment, checking the ABCs, airway, breathing, and circulation. Wound care, managing cuts, abrasions, lacerations, and controlling bleeding. Fractures and sprains, immobilizing fractures with splints. Burn management, cooling burns and applying dressings. Choking management, performing the Heimlich maneuver or back blows. Shock management, recognizing and treating hypovolemic or anaphylactic shock. Common conditions, managing seasickness, hypothermia, heat exhaustion, and dehydration. Medical care training focuses on advanced level care and the management of critical and prolonged medical cases. The scope is more extensive and includes advanced life support, administering oxygen and performing advanced CPR techniques. Managing advanced airways. Patient assessment, conducting full medical history and physical examinations. Monitoring vital signs such as blood pressure, pulse, temperature, and respiration. Wound and trauma management, cleaning, suturing, and managing deep wounds. Treating fractures with traction splints. Identifying and managing internal bleeding. Pharmacology, administering medications like antibiotics, painkillers, and antihistamines. Infection control, recognizing and treating infections, fevers, and sepsis. Diagnosis and prolonged care, diagnosing illnesses such as appendicitis, stroke, or heart attack. Managing chronic conditions like diabetes and hypertension. Telemedical assistance, communicating with shore-based medical professionals using telecommunication tools. Following remote medical advice. Emergency evacuation procedures, preparing and coordinating patient evacuation via helicopter or rescue vessels. Duration and certification: medical first aid training is typically a short course that lasts 1 to 3 days and results in a basic level certificate as per STCW V41. It provides fundamental knowledge for immediate response. Medical care training is more comprehensive, lasting 5 to 7 days, and results in an advanced level certificate as per STCW V42. It prepares senior crew members for prolonged and critical medical care on board. Medical equipment handled in medical first aid training. Crew members become familiar with basic first aid equipment such as bandages, burn dressings, splints, gloves, and AEDs. Medical care training involves advanced medical tools and equipment, including oxygen administration systems, intravenous, IV, fluids, blood pressure cuffs, thermometers, and suction devices. Key difference in responsibility in medical first aid training. The focus is on providing immediate, basic care to stabilize the patient until further medical help becomes available. The crew follows basic protocols and standardized procedures to prevent deterioration of the condition. In medical care training, there is a higher level of responsibility. Trained personnel are expected to diagnose conditions, decide on treatment plans, administer medications, and provide ongoing care for extended periods. They also coordinate with shore-based medical professionals for telemedical assistance and organize medical evacuations when necessary. Summary medical first aid training equips designated crew members with basic skills to respond to injuries and illnesses immediately. It is essential for initial stabilization and short-term care. Medical care training prepares senior crew members to manage serious medical conditions over prolonged periods. It involves advanced skills, decision-making, and treatment capabilities, ensuring that critical care can be delivered on board during emergencies or long voyages. Both levels of training are crucial for maritime safety and ensure compliance with international regulations, enhancing the readiness of seafarers to handle medical emergencies effectively. Bottom of form.
For more videos, subscribe Sailor 360 and stay connected.